Let me tell you about Eleanor. She's 73. Her daughter brought her into my office because Eleanor had started repeating herself in conversation and struggling to find words that used to come easily. Testing showed mild cognitive impairment, a warning stage that sits between normal aging and dementia. When I looked at her history, one thing stood out immediately. Eleanor drove everywhere. She sat most of the day. Nobody had ever sat her down and explained in real detail what a single daily habit could do for her brain. Here's the number that changed her mind that day, and I want you to really hear it. A large study tracking over 30,000 adults found that people with the highest fitness levels had a 76% lower rate of dementia compared to those with the lowest. 76%. That's not a rounding error. That's one of the most powerful modifiable protections against dementia that medicine has ever documented. And the intervention isn't a drug. It isn't a supplement. It's 10 minutes of brisk walking done daily. By the end of this video, you'll understand exactly why that number is real, the biological mechanism your doctor rarely has time to explain. What this 10 minutes will and won't do, the 3 mistakes that quietly waste your walk, and a plan to build this into your life starting tomorrow morning. Stay with me because what happened to Eleanor 12 months later is worth waiting for. I'm Dr. Richard, and I want to be upfront about something. I don't like overselling research, and I'm not going to oversell this. What I'm about to walk you through is genuinely well-established science. And I'll be honest about which parts are rock solid and which parts are still emerging. Here's everything ahead. The specific mechanism inside your brain that a daily walk actually triggers. What that 76% number really means and its honest limitations. The exact protocol, pace, duration, and timing that the evidence supports. Why walking specifically, and how it compares to running, strength training, and other movement. 3 mistakes that quietly reduce the benefit of your walk. What this habit will not fix on its own, and what else belongs alongside it. A simple plan to build this into a lifelong habit starting tomorrow. Let's get into it. Every single day your brain is doing something extraordinary. It's cleaning itself. There's a waste clearance system in the brain called the glymphatic system, discovered and described in landmark research. Published in the journal Science in 2012, this system uses cerebrospinal fluid to flush metabolic waste out of brain tissue, including beta amyloid, the protein that clumps into the plaques associated with Alzheimer's disease, and tau, the protein behind the tangles seen in that condition. Here's the part that connects directly to today's topic. This clearance system operates primarily during sleep, but it also responds to movement, specifically rhythmic repetitive movement like walking. That kind of motion drives a pulsing flow of cerebrospinal fluid through brain tissue that enhances this cleaning process. In plain terms, when you walk, you're not just conditioning your heart, you are physically helping flush waste out of your brain. Quick pattern interrupt. Think about how often you've heard, exercise is good for your brain, as a vague feel-good statement. This isn't that. This is a specific documented mechanical process happening inside your skull every time you go for a walk. Now, here's where the hippocampus comes in, the small seahorse-shaped structure deep in your brain, responsible for forming new memories. For a long time, scientists believed adults couldn't grow new brain cells in this region. That belief has been overturned. Research now confirms active neuron growth in the human hippocampus well into the 9th decade of life. And what triggers that growth more than almost anything else studied is a protein called BDNF, brain-derived neurotrophic factor, your brain's primary growth and repair signal. Aerobic exercise is the single most powerful non-drug stimulus we know of for elevating BDNF. In fact, a well-known trial published in the Proceedings of the National Academy of Sciences found that adults over 60 in a walking program increased hippocampal volume by 2% over a single year, effectively reversing 1 to 2 years' worth of typical age-related shrinkage in that region from walking. So, when Eleanor and I had this exact conversation, not the vague version but the specific one, walking clears amyloid, stimulates BDNF, improves blood flow to the brain, and grows new hippocampal tissue. She made a different decision than she'd ever made before because she finally understood what she was doing and why it worked. Here's something else worth understanding because it reframes how urgent this is. Dementia isn't a switch that flips overnight. The pathological changes underlying Alzheimer's disease, amyloid accumulation, tau tangles, vascular damage, appear to begin building silently 10 to 20 years before any symptoms show up. That means the choices you make in your 50s and 60s aren't just about how you feel today. They're actively shaping a process already quietly underway, whether or not you can feel it yet. Being honest about the number, I promised you honesty, so let's talk about that 76% figure directly, because how you interpret it matters. And this is where a lot of health content on the internet loses credibility. That number comes from a large observational study out of Norway, tracking over 30,000 adults over decades, comparing cardiorespiratory fitness levels to dementia risk. It's a genuinely strong finding consistent across multiple studies, with a clear dose-response relationship, meaning more fitness tracked with progressively lower risk. But it's observational, which means it can't prove exercise alone caused the entire difference, since healthier people also tend to exercise more for other reasons. Sleep better, eat differently, and see doctors more regularly. That said, epidemiologists use a specific framework to judge whether an association like this likely reflects real causation, not just correlation. On nearly every count, strength of association, consistency across independent studies, a clear dose-response relationship, and a biologically plausible mechanism now backed by direct experimental evidence, this relationship holds up remarkably well. A more conservative, still remarkable estimate from the broader research is a 30 to 40% risk reduction from sustained aerobic activity over a lifetime. Whichever end of that range you land on, this remains one of the most powerful preventive interventions we have. The World Health Organization and major neurology and Alzheimer's research bodies list physical activity among the most important modifiable risk factors for dementia that currently exists. The exercise. The protocol is simple. 10 minutes of brisk walking every single day. Brisk, not a stroll. The target is a pace where you can still speak in full sentences, but couldn't comfortably sing. That's roughly 60 to 75% of your estimated maximum heart rate, which you can estimate by subtracting your age from 220. For a 65-year-old, that's a target range of roughly 93 to 116 beats per minute during the walk. Why walking specifically rather than strength training, yoga, or running? Let's actually compare them because this matters, and I don't want to just dismiss the alternatives. Strength training has real documented cognitive benefits. It reduces insulin resistance, lowers inflammatory markers, and emerging evidence suggests it also elevates BDNF, though less consistently than aerobic activity. It absolutely belongs in a well-rounded routine, especially for the muscular and bone benefits we've covered in other videos. Yoga and Tai Chi have well-documented benefits for balance, cortisol reduction, and mental well-being, and I'd never discourage either. But the specific chain of events we're discussing today, the rhythmic pulsing of cerebrospinal fluid, the sustained BDNF elevation, the increase in cerebral blood flow, is most strongly and consistently triggered by sustained rhythmic moderate-intensity locomotion. And running produces similar, sometimes slightly stronger, cardiovascular and BDNF effects in younger populations. But for most adults over 60, the joint impact and injury risk of running often outweighs the marginal benefit over brisk walking, particularly if it discourages consistency. A 10-minute walk you do every single day for years beats a running habit you abandon after 6 weeks due to knee pain. Walking wins on a different metric entirely, sustainability. It's the most accessible, the most studied, and the most consistently supported form of movement across every age group and fitness level, which is exactly why it's the intervention with this much research behind it. 10 minutes daily is the floor, not the ceiling. 30 minutes, 5 days a week, is the standard associated with the strongest cognitive benefit in the research, consistent with American Heart Association guidelines. But here's the detail that matters more than almost anything else in this video. 10 minutes done every single day beats 30 minutes done sporadically every second or third day. Your brain responds to a consistent, repeated signal far more than an occasional large one. Why it works? This is the part your doctor rarely has time to walk through in a short visit. 1. It flushes toxic proteins out of your brain mechanically. As covered, rhythmic movement enhances lymphatic clearance of amyloid and tau, the two proteins most strongly tied to Alzheimer's pathology. 2. It floods your brain with its own repair signal. BDNF elevation from aerobic movement promotes neuron survival, strengthens synaptic connections, and directly stimulates new hippocampal growth, the region responsible for forming new memories. 3. It protects the blood vessels feeding your brain. Dementia isn't only a disease of protein buildup. A meaningful portion of cases, somewhere around 20 to 30%, involve vascular damage, reduced blood flow from small vessel disease, And growing evidence suggests vascular compromise plays a supporting role even in classic Alzheimer's dementia, since amyloid clearance itself depends on healthy, functioning blood vessels. Aerobic movement improves the function of the smallest blood vessels in your brain, reducing inflammation and maintaining healthy blood flow to regions particularly vulnerable to decline. Quick pattern interrupt. Picture your own morning routine right now. Somewhere in there is a 10-minute gap, and that gap is where this entire protocol lives. 4. It builds cognitive reserve, a buffer against future decline. Cognitive reserve is your brain's capacity to tolerate underlying pathology before symptoms ever appear. People with higher reserve can carry meaningful amyloid burden visible on brain imaging without showing dementia symptoms because their brains have built denser, more efficient neural networks. Exercise is one of the strongest known contributors to that reserve, alongside education and social engagement. A 55-year-old who starts walking briskly today may be building a buffer that doesn't become clinically relevant until their 80s. When instead of meeting dementia criteria, they're managing mild changes that don't meaningfully affect their independence. 5. It improves your brain's ability to use insulin properly. Some researchers now describe Alzheimer's disease as having a metabolic component tied to how neurons respond to insulin, sometimes informally called a type 3 diabetes pattern. Neurons have insulin receptors and depend on functioning insulin signaling to manage their energy and resist cell death. Aerobic exercise is one of the most effective tools we have for improving insulin sensitivity throughout the body, including, the evidence increasingly suggests, inside the brain itself. 6. It improves the deep sleep where your brain does its heaviest cleaning. Your glymphatic system works hardest during slow-wave sleep, the deepest stage, when brain cells actually shrink slightly to widen the space fluid can flow through. Just one night of poor sleep measurably raises amyloid levels in cerebrospinal spinal fluid. Regular aerobic exercise is one of the most effective non-drug ways to increase slow-wave sleep, meaning your morning walk doesn't just help you during the walk itself. It improves the cleanup your brain does that same night. Walk during the day, sleep better at night, brain cleaner by morning. The two mechanisms reinforce each other in a loop that compounds over time. 7. It builds momentum and confidence that extends beyond the walk itself. Once patients like Eleanor understand the specific mechanism behind what they're doing, this stops feeling like generic advice and starts feeling like a daily act of genuine self-protection. That shift in mindset tends to make the habit stick in a way vague encouragement never does. Put all of that together, and 10 minutes of walking becomes a brain-cleaning mechanism, a growth hormone stimulus, a vascular protector, a metabolic tool, and a sleep enhancer, all before you finished your morning coffee. The 3 mistakes. Mistake 1, walking too slowly to count as brisk. A leisurely stroll doesn't reliably reach the moderate intensity threshold needed to meaningfully elevate BDNF or drive glymphatic flow. Check yourself with the talk test. If you can comfortably sing, pick up the pace. If you're gasping and can't form a full sentence, you've overshot it. Ease back slightly. Mistake 2, treating it as optional some days. 10 minutes daily consistently outperforms a longer walk done sporadically. Skipping days breaks the repeated signal your brain relies on. Attach it to something automatic right after breakfast, right before checking your phone, so it doesn't depend on motivation, especially on the mornings you least feel like it. Which honestly are the mornings it matters most. Mistake 3, ignoring the other pillars entirely. 10 minutes of walking is powerful, but it isn't a cure-all, and I want to be direct about that rather than let this video oversell what one habit can do. What this won't fix on its own. Honesty about limitations is part of what builds trust, so let's be clear here. 10 minutes of walking done in isolation is unlikely to overcome the dementia risk that comes with severe untreated high blood pressure, chronic heavy alcohol use, uncontrolled type 2 diabetes, chronic sleep deprivation, significant social isolation, or advanced smoking-related vascular disease. Blood pressure control remains the single most important modifiable risk factor for vascular dementia specifically. So if that's not well managed, that conversation with your doctor matters as much as anything in this video. Social engagement, maintaining real relationships, continuing to learn new things, staying mentally and socially active carries a protective effect against dementia that some research suggests is comparable in size to physical activity itself. An uncorrected hearing loss, increasingly recognized as a modifiable risk factor, forces your brain to spend extra cognitive resources decoding degraded sound, resources that would otherwise go toward memory and executive function. Walking is your foundation. It's the most accessible, most powerful single daily behavior available to nearly everyone watching this. But build the other pillars around it rather than expecting one habit to outrun everything else. How to get the most from your walk. A few refinements that meaningfully improve the results based on the research. Walk outdoors when you can. Sunlight supports vitamin D production and low. Vitamin D has independently been linked to accelerated cognitive decline in research from the University of Exeter, with severe deficiency, associated with nearly double the dementia risk in some studies. The outdoor environment also adds sensory variety, uneven terrain, changing scenery that gives your brain extra stimulation beyond the physical movement itself. Choose a route with some variation and add a gentle incline if your body tolerates it. The added cardiovascular demand produces a stronger BDNF response in the same amount of time. Leave the headphones off some of the time. Actively attending to your surroundings adds a layer of cognitive engagement that passive listening doesn't provide, since your brain has to actively process an unpredictable environment rather than tune it out. And walk in the morning when possible. Your glymphatic system tends to be most responsive to movement earlier in the day, and a morning walk sets a favorable tone for blood pressure and insulin sensitivity that carries through the rest of your day. The 4-week plan, week 1. 10 minutes daily, moderate pace, focus purely on consistency, not intensity. Pick a fixed time and treat it as non-negotiable. What you'll notice: mild breathlessness at a brisk pace initially, easing within days as your body adapts. Week 2. Same 10 minutes, but consciously check your pace against the talk test each day, adjusting to stay in the brisk zone. What you'll notice: the walk starts to feel like part of your routine, rather than a task you have to remember, and some people notice slightly deeper sleep that same week. Week 3. Add gentle variation, a slight incline, a different route if available. Keep the daily 10 minutes as your floor. What you'll notice: some people report slightly better sleep and a subtle lift in mood or alertness by this point, alongside a small but real sense of accomplishment tied to the streak itself. Week 4 and beyond. If it feels sustainable, extend toward 20 to 30 minutes on some days while keeping 10 minutes as your absolute daily minimum, even on your busiest days. This isn't about chasing a personal record. It's about a signal your brain receives every single day for years, not weeks. The research on this is unambiguous. Small daily doses sustained over years produce the meaningful, lasting protective effect, not occasional heroic efforts. Safety note: if you have a cardiovascular condition, uncontrolled blood pressure, or haven't exercised in a long time, check with your doctor before starting a brisk walking routine, and build up gradually rather than starting at full intensity on day 1. Walking is low risk for most people, but brisk should still feel appropriately challenging for your current fitness level. Not painful or alarming. Close. 12 months after that conversation, Eleanor's cognitive testing scores had genuinely improved. Not a dramatic reversal, I want to be honest with you about that. We don't make claims like that here, but measurably, meaningfully better. She still walks every morning. Here's what I want you to take from this. Pharmaceutical research into Alzheimer's has spent billions of dollars with a track record of repeated disappointment, because treating a disease that's been quietly building for decades is extraordinarily difficult once symptoms appear. Prevention built into something as simple and free as a 10-minute walk is where the evidence actually points right now. You don't need a gym, you don't need equipment, you need 10 minutes, a decent pair of shoes, and tomorrow morning. If this helped you, subscribe. I put out a new video every week, no fluff, just what actually matters for your health after 60. Next week, I'm covering the real reason your grip strength predicts how long you'll live, and a simple test you can do at home in under a minute. If today made sense to you, that one is going to land even harder. Your brain responds to what you actually do every single morning. Start tomorrow. I'll see you next week.